So the word migraine is actually derived from the ancient Greek hemicrania, or half skull. And so, for millennia, people recognized that migraine had this unilateral component to it. But the question is why? And so that's what prompted us to do some of this research. We're actually doing a suite of 3 studies, and they're all being presented at this year's American Headache Society conference. So the first study is a scoping review, which it reviews what the existing literature is on migraine with left-sided headache and migraine with right-sided headache. And it's probably important to acknowledge that migraine is more than headache. A lot of people equate migraine equals bad headache, but in reality, all of the symptoms of migraine are just as much migraine. So sensitivities to light, to noise, to smell, mid-face pain, pain at the base of the skull, disequilibrium, etc., all of those are just as much migraine. But for the purposes of our studies, we chose to focus on the headache component. And so the scoping review reviews what's known about left and right migraine. And there are differences that have been previously identified, particularly in the domains of psychiatric, cognitive, and autonomic function. So that's one piece, and that's actually been published already. And then the new data that we're presenting at the conference is a cross-sectional secondary data analysis. So we pulled 20 years of intake questionnaires from the headache clinic that I work at. And there's questions in there that where people have to draw on a face to see where their pain is typically located. And then there's another question that says, is your headache worse on one side usually? And so we use those. And so we ended up filtering out 5,000 new patients over the last 20 years. And we ended up with a little over 300 who met our criteria of basically having one-sided headache during attacks. And then we compared lefties to righties across a bunch of clinical characteristics. And the main finding is that it appears, at least in our subspecialty clinic headache population or migraine population, that left migraine appears to be associated with more days per month with headache, and the days that people have are more severe. We also, the third one we're also presenting here is a poster, and that is we did functional MRI during unilateral attacks. So where patients had to come in during a migraine attack where they had to say that head pain was exclusively on one side without crossing midline. And we found, at least in preliminary findings, that there might be differences in the brain in left and right migraine.